can you address some of the myths? People say your vagina never quite gets back to its normal state. Is it true or is it not true? Some people also say that you will leak, so you have Pampers on for weeks. I have not experienced it, but you guys may want to share.
Well, I didn't experience anything like that. I mean, with a perineal tear, you have a bit of pain, discomfort when you're sitting, when you have to use the loo and all that. But if you treat it well, if you're taking I know sometimes they give you suppositories to ease the pain and all that. Within some few weeks, it's healed, and then you're fine.
Back to normal.
Yeah, and then you need to do your pelvic floor exercises as well to tighten the muscle. Because it's a muscle, so you need to.
But can you have sex immediately after, or it's like a process?
But whether you do CS or you do natural delivery, you're not supposed to be having sex.
Oh, you're not? Oh, you know.
at least for 6 weeks, there shouldn't be any activity.
Sex. Okay.
You know, because the womb, whether you have CS or vaginal delivery, the womb is still open. And that's why, so that so-called leak you're talking about, it doesn't matter how the baby came out.
You still experience
because the placenta is kind of like skin. On your bones, it has been ripped off. So there's a sore, literally speaking. There's a sore inside the womb, and that's where the pain comes from. And that sore needs to heal. Yeah. And so until it heals, there's going to be discharge. Because I mean, if you have a sore, there's discharge. That's why you clean it every morning and all that. So that discharge has to come out. So that's the so-called leak. Yeah. You know, so it has got nothing to do with whether it's CS or vaginal birth. So the womb is open for up to 6 weeks, sometimes more. You know, so long as there's a discharge, there shouldn't be any sexual activity. Okay. Now, everyone, I mean, this is something that you get taught at the birth classes. But you see, unfortunately, most people don't. You see, most people actually don't even attend antenatal. That's the first issue we face as doctors. They don't even come at all. So,
how important is it to attend?
If you don't, it's at attending an antenatal is where you get to attend the birth classes, where they actually take you. I mean, I know it's not as effective as it's supposed to be, but at least almost every government facility where there's a maternity unit has birth classes, but the women don't attend. So that's why there's a lot of misinformation. You know, because even the discharge, there are different colors of discharge. So you start off with bloody discharge, and the blood will clear over time. Eventually becomes clear. Yes. And then we'll tell you about this 6 week mark. And so if it's prolonging beyond the 6 weeks, or if there's this change or that change, you need to report. If you don't report, it gets infected. The infection is going to, affect your fallopian tubes. And so we have women who, after delivery, get infection, a pelvic inflammatory disease, which then affects subsequent, so their fertility is affected for subsequent pregnancies. You know, all these things are taught at the birth classes. So as much as there's understaffing and it's not as effective as it should be, where there is these birth classes, women need to be encouraged to take up, to attend so they can learn some of these things, because some of the complications, like she was saying, once you are prepared for it, even the pain, if somebody actually takes their time to explain to you the reason for the pain and the timing, the frequency, you can
tolerate it.
Yes, your tolerance is actually boosted. Yes. And some people they may even teach you how to reduce the pain. Like you can actually, there are techniques you can actually use. But you see, if you're already in the pain and I'm now teaching you, but if you are prepared and you practice, so when you watch movies, they actually go with the husband and they are doing the husa.
Is it true? Is that what happens?
Yes, it happens. It doesn't necessarily happen.
Scratching your husband.
So in Ghana currently, most of the hospitals they don't allow the males to come because it's not private. I mean, there are several women delivering at the same time, so if all the men are, so that's a challenge. But I mean, some other facilities have private rooms where the husbands can go. What I'll say is that if you're a husband and you go with your wife to the labor ward, please stay by the head. Don't get adventurous. Because we have had men faint in the delivery room, and then it causes problems.
Wow!
Because myself, as a medical doctor, the very first time I saw a delivery, I almost passed out.
Why?
It is not easy.
And it's bloody.
I was standing there. I was assisting, and then my leg was shaking. I was like, I was blacking out. I was, what is going on here?
But Doc, you know what? That's in my case. That's what helped me. My husband saw the points where my baby's head got stuck, and she couldn't come, and the maneuver they had to do. So he saw the whole thing. So when the doctor suggested CS for the next delivery, he understood, and he was always encouraging me when I was in denial. He was like, "Mommy, I saw what happened. It's for the best for you and the baby. Let's get this done. I'm with you. You know. So maybe it's good for them to be there all the time.
We should bring men next week.
Yes,
to talk about supporting your husband,
yes,
your
it
wife
really
through
helped.
the process.
Yes.
Okay, we make that happen next week.
We'll try.
Thank you so much,
But
Dr. Kelvin.
let me just chip in though that for the baby. So